Hello, I am Dr. Mazen Mullah. I am a part-time attending physician with Henry Ford Heart and Vascular Institute. I am also a division head of advanced cardiac imaging at King Abdulaziz Cardiac Center and associate professor at King Saud bin Abdulaziz University for Health Sciences in Riyadh, Saudi Arabia. I'm the principal investigator of the FIT project, the Henry Ford Exercise Testing Project. Today, it's my privilege to discuss our study, which will appear in the upcoming issue of Mayo Clinic Proceedings, Sex Differences in Cardiorespiratory Fitness and All-Cause Mortality, the Henry Ford Exercise Testing Project. The Henry Ford Exercise Testing Project is a retrospective study which enrolled nearly 70,000 patients who underwent a symptom-limited stress test using Bruce protocol between 1991 and 2009. The aim of the FIT project was to investigate the relationship between objectively measured exercise capacity and risk of all-cause mortality. All patients underwent a treadmill stress test on the Bruce protocol, which was symptom-limited and clinically indicated. The purpose of the present analysis is to determine whether gender modifies the relation between fitness and outcomes, mainly all-cause mortality in this analysis. In this study, we have identified nearly 57,000 patients free of coronary artery disease or heart failure at the time of the study. Patients were followed up for a median of 10 years to identify the risks of all-cause mortality. Over a median of 10 years, there were 6,402 deaths. We observed an inverse relationship between baseline exercise capacity and risk for all-cause mortality in men and women, with a hazard ratio of 0.84 per 1 METs for men and 0.83 for women. We also noted that there was a significant interaction between gender, fitness, and outcome. Thus, in this population referred for a clinically indicated stress test, women demonstrated lower fitness than men by about 2 METs level, but had a similar prognosis at 2.6 METs lower than men. Both men and women have relatively lower risk of mortality with higher METs. Based on our data, the risk of all-cause mortality is increased with decreased fitness. This is seen in both men and women. To get the same benefit of improved fitness, men need to achieve higher fitness level compared to women. One can potentially say that attempts to improve fitness via increasing physical activity is important for both men and women. Further studies should determine sex-specific minimum fitness levels for both men and women, which can be used later on for risk stratification, as well as to identify the underlying conditions between the observed differences in the prognosis between men and women at the same fitness levels. On behalf of my co-authors, thank you for your attention and interest in our study.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.